Well, good morning. More than 3.3 million vaccine doses have been administered in our city, now including more than 105,000 doses this past weekend alone. That huge number includes the more than 26,000 doses administered yesterday at Toronto Vaccine Day at Scotiabank Arena. And I want to say thank you. It was an incredible event, and I want to say thank you to our partners, including in particular UHN and Michael Garron Hospital. They did all the healthcare part of this, and of course MLSE, Maple Leaf Sports and Entertainment, and Scotiabank helped us with the facilities and with other things that made the occasion enjoyable for people. But the real heart and soul of the whole thing was the hundreds, literally hundreds. I think the estimates were about 800 people who came out, some staff, but many others volunteers, to help make sure the day was as well organized as it was, and I think met the satisfaction of all the people, the 25,000 plus people who came out. I want to also thank the people who did come out to get vaccinated yesterday. It really was quite something. I stood there for several hours talking to people in the lineups which were moving. It wasn't really a lineup where you stood for very long, which is a good thing. And I think those people did something for themselves and for their families and coworkers, and they helped make a little bit of history. I wasn't too hung up on whether we set records or not, but I just thought the notion of having thousands of vaccinations take place on a given day at such an important stage in our battle with COVID-19 was very important. We're making great progress in the vaccination effort, and I firmly believe that it will help protect our city as we move into stage 2 on Wednesday, when quite literally hundreds of additional businesses will be able to open their doors. As of this morning, everyone in Toronto, including young people aged 12 to 17, is eligible to book an accelerated second dose of COVID-19 vaccine. To accommodate this surge in demand for vital second doses, and the second doses are vital for everybody without exception, I'm announcing today that the City of Toronto immunization clinics will be adding 375,000 vaccination appointments, 125,000 appointments for the week of July 5th, 125,000 appointments for the week of July 12th, and another 125,000 appointments for the week of July the 19th. These appointments will be available in the provincial booking system tomorrow morning. These 375,000 appointments build on Team Toronto's success with Toronto Vaccine Day, where 26,771 people were vaccinated, and it will help us continue the city's progress towards getting people fully vaccinated. We had a presentation on this morning, as we normally do, and you can see that there are areas of the city where we have to continue with our work to make sure that these vaccinations are accessible to people who might have a little more difficulty for one reason or another getting themselves vaccinated, first or second dose. I want as many people as possible fully vaccinated over the next 2 weeks so that we are prepared as best we can be to move into step 3 of the reopening, because obviously step 2 comes about this week and we want to move to step 3 as soon as is possible. More than 35% of Toronto adults are already fully vaccinated. That number is from the last public health dashboard, which was put out last Thursday. So I anticipate we will see those numbers jump even higher this afternoon when that dashboard is updated based on the weekend's activities. And that's especially the 25,000 plus of the vaccines given at Scotiabank Arena yesterday were second dose, and so that will affect that number in a positive way. As of this morning, second dose appointments can be booked by anyone who received a first Pfizer or Moderna vaccine at least 28 days ago, or who received a first AstraZeneca vaccine at least 8 weeks ago. If you're eligible, please get your second dose. 1 dose of vaccine is good, but 2 is much, much better and represents the best protection against COVID-19 and the Delta variant. So please don't put it off. Don't say you'll do it after the summer is over, or don't say you'll do it when things get quieter. It is now that is the right time to do this in many different respects. We're not letting up on our first dose efforts either. Those are important. You know, it's an accomplishment for us as a city to have moved in a pretty fast order to get 75+% of people with a first dose, but that still leaves a significant number who have not had a first dose. So there are some 36 clinics operating in the City of Toronto today, and this is a number, the 76% number of people who have had a first dose, that we simply have to get up even higher. And we will continue to do so, taking the vaccines to people who have challenges getting to the vaccines. We've got to make sure we take down the barriers and increase accessibility for those who might have a bit more difficulty getting to that first dose, and then for that matter, getting the second dose as well. So please get vaccinated now. making sure that as many people as possible get a second dose is a vital tool, the most vital tool that we have in the fight against COVID-19 and the Delta variant. The Delta variant is more infectious than other strains of this virus. Recent studies have shown that 2 weeks after the second dose of a COVID-19 vaccine, a person's protection against the Delta variant is 50% higher than one dose alone. So you can see what a difference it makes in protecting you against a Delta variant that has proven to be quite dangerous in other parts of the world. So don't risk it. Don't risk your loved ones. Don't risk the progress of the city. Please get fully vaccinated. You can see across Europe, including Britain, a slowing down of their reopening because of the Delta variant. And they were running ahead of us, as you know, in some of these countries on vaccination. It is a real threat there in Europe and in Britain, and it's such that it has caused their reopening timetable to be slowed down after it was announced, and we just don't want to see that happening here. We want to fight it off here with our very best weapon, which is the vaccines. I got my second dose yesterday. As you know, I received a first dose of AstraZeneca and Moderna as my second dose. I feel fine, and my arm is a bit tender, and I am a bit tired today, but that's it. And I'm glad to know that I've done my own part to protect myself, but also to protect my own family, the people I work with here at City Hall, and all the other people who live in the city. It's a tiny part each of us can do to protect the city as a whole as well. The 375,000 appointments for the weeks of July 5th, 12th, and 19th will go live tomorrow in the provincial booking system at 8 o'clock in the morning. Residents can click on the Book a Vaccine button on the toronto.ca/COVID-19 part of our website, or by calling the provincial vaccine booking line at 1-833-943-3900. If you need more information, we can help with our VaxTO text line, which includes directions on vaccine appointment bookings, information on vaccines, and upcoming telephone town halls. And in order to access that information, you can just text the word vaccine to 1-833-750-0888 or 833-750-0888, and you can get more information there. We're making outstanding progress getting people vaccinated. I think you've seen some of the comparative write-ups that have been done with respect to the performance by the City of Toronto and by our outstanding health partners. These 375,000 new vaccination appointments over the next few weeks will help that progress continue so that we can bring this pandemic to an end. Please sign up for these appointments and get vaccinated, your first dose and your second dose, to protect yourself from COVID-19 and from the Delta variant, and to protect our progress as a city. We are doing so well as a city. Now is the time to double down and to repeat yesterday's very positive experience, yesterday's great effort, but to do it on a neighborhood-by-neighborhood basis so that we really put a push on to make sure that we can put those big numbers up on the board of people getting vaccinated in neighborhood-by-neighborhood right across the city. Thank you for your attention, and I'm now happy to answer any questions you have on this or anything else.
Thank you, Mayor Tory. We will now open the floor up to questions. As a reminder, it's one question, one follow-up, and then when we do call your name, please unmute yourself. First up, we have Matt Bingley from Global. Go ahead, Matt.
Good morning, Mayor. At the vaccine clinic yesterday, Scotiabank rather, aside from maybe finding the end of the line, I think many people would say that that clinic was very well run, and many are probably looking today at the city and wondering why it's not done every single weekend. Is that something that you would consider, especially in some of the more marginalized communities?
I asked that very question this morning at our morning command table meeting. And, when we saw some of the heat maps today that showed that, for example, in the northwest of the city, we are still running at levels of vaccination under where we want them to be and where we need them to be, whether there was an event we could have at a place, there is only one Scotiabank Arena, but there might be some place we could have an event like that. It is, let's remember, a huge logistical undertaking because we already have organized 9 city-run clinics, and we're doing, I think, 36 total clinics across the city today. So you're drawing resources off to do something special like that, but you're also achieving big results. So it is something that is under advisement. We're trying to see what more we could do, and I'm sure that this will not be the last sort of big event we have that is meant to attract some attention too, because you want people to see that this is going on, and perhaps that will remind them to get vaccinated.
And just on the race against the Delta variant, you touched on the concerns looking at other jurisdictions. Is there anything else that you can do other than simply warning people that this stalls the reopening plans?
I think that, we have to continue to draw to people's attention the experience that we've seen in other countries, and that the Delta variant has been a real factor in slowing down, for example, a much lauded reopening schedule that was put in place by the British government. And they've substantially slowed down, I think, by a month. And I think people here have certainly made it very clear to me, and I support them in saying we don't want to be closed down any longer. And so I think that beyond what is very intensive contact tracing and work that's being done on what is now a reduced number of cases, many of which are the Delta variant, I think the key is for people to get vaccinated because it provides that extra level of protection to them, especially for the second dose. So I think those are the things we're going to continue to focus on, and we're watching it all very carefully. And I hope that if we do get vaccinated and we do continue to follow the rules that are in place, we will be able to avoid some of the circumstances we see happening in quite a few countries in Europe.
Thanks, Matt. Next up, we have David Ryder from the Star. Go ahead, David.
Good morning, Mayor. I heard you on television this morning say that of the 26 or 27,000 plus vaccinations yesterday, only 978 were people who booked for first doses. And I'm just watching that sort of 75, 76% rate that really has not budged while the second dose rate is rising. I know you've said that, we've been at it for a while in communities with mobiles and pop-ups. I'm just wondering, I guess it's following on Matt's question, is there anything more we could do to sort of supercharge the first dose rate the way the second dose rate has been supercharged lately?
I think you guys must have been at the meeting this morning surreptitiously online, but I asked that very question this morning. I asked it in the context of whether we could have another, one or more special events in some of the areas where we see under-vaccination. But I also asked it within the context of our VaxTO efforts with the ambassadors and people knocking on doors and the pop-up clinics, and can we intensify that effort even more and even add new techniques? Because there is no question but that, the rate of first vaccination does slow down after a period of time. I mean, to get to the 76 or whatever the number will be when it comes out today, that kind of number is impressive, but it still leaves, 20 some odd % of people who are not even receiving a first dose. So we are looking at every means, as well as continuing with the things we're doing today with 36 clinics. They're right across the city. They're in schools and community settings and pop-up clinics, but we're looking to find ways to intensify that because we have to keep driving that number up as high as we can get it, and then the second dose to go with it.
Thank you. And following that, I'm just wondering, we're all kind of looking at the drop in new infections and new hospitalizations, but I think all the experts say with any level of reopening that those numbers will start to turn around or at least won't fall as quickly. And unlike the other reopenings, this time we have vaccination, but we also have this highly infectious Delta variant. Have you had any briefings in all those questions you asked about whether we're going to see, if not a wave, then see a greater number of Delta cases presenting themselves in Toronto?
Well, Dr. Davila and Dr. Lamptey, who we rely on for this information, have been keeping us up to date with respect to the Delta variant on a continuous basis since it first popped up. And I can only say that there has been no talk of a fourth wave. There has been more talk about how the best advice we got was to really put a push on, and hence you see the efforts made even with the Scotiabank event yesterday to really put a push on second vaccinations on the basis that provides this hugely increased protection against the Delta variant. And so, we're watching it every single day and getting reports every single day on what are still a relatively small number of Delta variant cases in the province of Ontario and here in the city. But it's something we are watching carefully because we've seen the devastating impact it can have both on people's health, but also on the economic recovery that we're just now beginning to experience here in Toronto.
Thank you. Next up, we have Momin from 680. Go ahead, Momin.
Good morning. Thank you for taking my question. Mayor Tory, if I could just circle back to what David and Matt were asking about in terms of just being at that 75, 76% number for first doses. In your meetings, is there any discussion as to why we've kind of stalled at that number and what the reason is that the people aren't making the leap there? Is it just hesitancy, or is there something else that they've been able to either use data or just, any other information to figure out why we've stalled at that number?
I'm definitely having the Zoom number changed tomorrow morning because that too was discussed this morning. I asked whether we might do some additional research in, say, the northwest part of the city where we've seen numbers of under vaccination. You know, the previous research we've seen and just common sense says that in many cases, the challenge for us is that people are hesitant about the system. They, you know, want to make sure that they hear about the safety of these vaccines from somebody they trust. Sometimes they find it hard to get to the places that we might have established for the vaccination. So hence, we've been doing the pop-up clinics and the workshops on the vaccines and so on. So I will just say to you that we're going to be looking into that in every which way that we can. One of the great things we have is a lot of data on who has got vaccinated, almost down, as you know, to the postal code. And so, in fact, down to the postal code, so that we can, you know, start to take a look at that and see exactly who it is, demographically and otherwise. And as I said, we're looking at, you know, any additional options that can supplement what I think is a really thorough VaxTO equity program. But we've got to do better. We've got to, you know, get those people vaccinated. And I'm optimistic that the ambassadors and the town halls and all the things we're doing can help with that. But we've just got to keep the push on.
And so if I could just change subjects here and ask you about the renaming of Dundas. You've put out a release this morning saying that you're in support of exploring or in support of changing the name to something else. And I just wanted to ask you if you feel that opens the door, or you'd like to see the door open to exploring the names of other parks, streets, institutions in the city, as we learn, particularly in the last few weeks, that the history that we've been taught isn't necessarily the history that we have in the city, and whether we should consider all those other institutions and streets and things that we have named after other people.
Well, one thing we can't have is to have, you know, everybody out there making their own interpretation of history and making government decisions, important ones, and community decisions on that basis. And so right now, for example, there are about 60 street names that have been brought to the city's attention that where it's claimed there's some, you know, historical events that have happened that would cause those names to be reconsidered. And the good news out of this report is that the city manager and his team will be bringing forward a report in the spring that sets out a framework pursuant to which any example going forward can be considered as to whether it's appropriate. Because I think what you have to do is look at this in an orderly manner, and you are trying to make sure that, you know, where you make a change, it is a thoroughly justified thing to do, you know, based on a number of considerations. So I think there will be a framework in place, and in the meantime, I think, as you know, there's a moratorium in place on these changes until such time as we have a proper framework to deal with them. But this one, Dundas Street, was a case, you know, by itself, in the sense that I had asked for a specific report in light of all the interest that and concern that existed in the community about Dundas Street and about Mr. Dundas, and we came back with a very thorough report, and including an extensive process of consultation on that subject. And so it could be dealt with on a one-off basis, and now does form the basis of a recommendation to City Council and to the Executive Committee. But I think otherwise we're going to have an orderly process that sees these things handled perhaps not that much differently than Dundas Street, but in an orderly fashion, as opposed to, you know, people just deciding because there's a petition or some other such thing, no offense to that, that means automatically something's going to change.
Okay, actually, we do have a question from Ji Yun from CP24. Go ahead. You'll just need to unmute yourself on your phone. G, can you hear us? Yeah, do you want to send her that? Okay. We'll just give it a couple seconds.
It's okay.
Oh, there.
Hi there.
There
Okay,
you are.
yep, we can hear you.
Yep.
Okay, thank you, Mayor. It's Jean Lee from CP24. A couple of questions. Just wanted to know, we've seen huge success with Cafe TO. Is this something that you will consider keeping as a regular thing moving forward once the pandemic is over?
I was asked these questions in the last few days about Cafe TO and Active TO, and my answer is unequivocally yes. Now, we have to refine exactly what form they take in a post-pandemic environment, and, you know, learn from the experience that we're having at present with the Cafe TO installations, of which 1,000 plus restaurants are benefiting. Same with Active TO. You know, even this year when we didn't go back to exactly the same regime we had, there was some controversy about that. But I would very much like to see these become a permanent part of the city's life, because I think if you look at how the city feels and how it looks and how it's helping the hospitality business and how much people enjoy the Active TO, I think it's something people want, but in an appropriate manner, carefully thought out. And that's exactly what we'll do once we get through this summer. Is I'd like to ask, you know, for some recommendations on how we can make these initiatives permanent. And
is that something you will also consider for some of the new bike lanes that have been installed?
The bike lanes were put in, in all cases on the basis that they would be, they were principally to help people get around during the pandemic where they might have some concerns about traveling on public transit, for example. But, I certainly am very, very open to the notion when we do the evaluation that was committed to, and that's to be done, I think, at the end of this year for Bloor Danforth University, and I think as well for the new ones on Yonge Street. And I want to look at the evidence and see, how well used they were, how much people liked them, what the impact was on other forms of transportation, including trucks and cars and transit vehicles. But, again, we have a need, pursuant to our own bike strategy, to keep pushing ahead with more bike infrastructure in a city that is in the 21st century and trying to battle climate change and make sure we adapt to how people get around. So we'll see about those are slightly different, and we'll see based on the evidence.
Okay, that's the last question for today. Thank you, everybody. Have a great Monday.